So how do we assess a patient with a VAD, a ventricular assist device? Well, all of our other patients we do ABCs on, airway, breathing, circulation. With VAD, they also have an additional ABC. We need to auscultate, check batteries and power, and then consult. So beginning with auscultation, we're going to be listening to see if we can hear this pump running. The place we're going to auscultate for that is at point of maximum impulse, at the apex of the heart, where you would put V4 of your 12 lead. So you're going to be listening for a to hear that electrical pump running. If you hear it running, sweet. If we don't hear it running, now we're in troubleshoot mode. So we're going to go down and be checking batteries and power and be looking at our control unit. The control unit should be illuminated if it has power. With that illumination, there will be lights and indicators on there. So anything lit up green is good. Anything that's yellow is a warning symbol. Anything that is red is dangerous or a life threat. Now, if it's not illuminated, then we continue our power troubleshooting. So we go check batteries. So 2 batteries, and they'll have the little buttons on them like typical batteries do, where you push it, see the bar indicators, how much battery life is left. If there is no power to the batteries are dead, we need to swap out the batteries if we have that ability to do so. If not, they also come with a power supply cable to where inevitably you can take them, plug them into a typical outlet. Okay, so if we've done auscultation, pump's not running, we've done batteries and checked power, no power, nothing's on there, we can do C, consulting. We can check with the VAD center, see what to do, okay? But if you're at that point where ABCs have failed ×2, then we begin thinking about CPR. So ABCs failed ×2, a necessity to begin CPR. Another indicator, if an end tidal is less than 20, end tidal is still an accurate vital sign in patients with a VAD. So they don't have a pulse. Without a pulse, you can't get a blood pressure. Heart rate, independent, doesn't really matter. The VAD's doing its own thing. So end tidal is a great assessment tool to check overall perfusion status. So if end tidal is less than 2, that's showing significant hemodynamic compromise and a necessity to begin CPR. So one big misconception in these is a lot of people think if you begin chest compressions on them, that it's just going to rip that pump off the heart and just make them bleed out internally. It's not true. There's no evidence to show that doing chest compressions on a patient with a VAD is not damaging at all to the VAD. So with those VAD patients, we just need to treat any symptoms or any causes that we see and rely on that VAD center to kind of help and guide us in any direction we need to for appropriate treatments.